Well, welcome to the National Spine Health Foundation Gala for our live spine talk featuring Dr. Leah Karen, an expert in research in spinal surgery, Dr. Christopher Good, president of the Virginia Spine Institute, and again, another expert in spinal surgery. We'll start with a simple question, Dr. Karen. There's been a lot of fear and misunderstanding, a lot of myths about spinal surgery. And when you take a look at hip replacement, knee replacement, most people accept that that's a great surgery and it works very well. And I myself can say so. I've had both my hips replaced, so I know that it works and it's an incredible operation. But there's actually been recent research that has come out that shows that spinal surgery actually is better in improving the quality of life than these well-established treatments that we know work. Can you comment about the research that's out there showing and proving that spinal health care, spinal surgery, modern surgery works?
Spine surgery actually improves the quality of life for patients almost as much or even better than patients who have had a total hip replacement or a total knee replacement. But studies from Canada and from Minnesota have already showed that results even in the mid-2000s, in like 2006 and 2005. And I think the newest studies are just revisiting the same thing, where patients who have had low back surgery have had greater or equal to improvements, quality of life improvements as patients who have total joint replacements or total knee replacements or total hip replacements. So we're trying to see also, I mean, even for other disease entities, not just confined to orthopedics, we're looking at equivalent or even better results after spine surgery. The thing for us is that for most orthopedic procedures is that it's a quality of life threatening issue. And as we've seen from all those testimonials, it's really, I mean, do you just want to, exist or do you really want to live? And it's because, I mean, people really care about their quality of life. And, low back pain, scoliosis surgery are all quality of life threatening issues. And we want to be better at living rather than just, just be living. So
That's great. Thank you. Thank you. Dr. Good, the spinal surgery over the years has evolved. What is leading to the improved success with spinal surgery?
It's really critical for us to work on educating people. And if you look at the evolution of spine surgery, you still hear out there, oh, you don't ever have it, it's a last thing, and oh, if you have another one, you're going to need another one. And we really are a bit behind where we need to be in terms of educating people about the potential benefits. And if you look at it, you go into the hospital with a blocked artery in your heart, no one leaves without a stent these days, right? And we do not have modern spinal health care defined and understood by the general population. Part of what I'm really passionate about is not only educating people about what we've been able to achieve, but also looking at things toward the future. And both my parents have had back surgery, as many people here know, and my dad had a major spine surgery in the 1970s, and I tell people all the time, it's not your father's spine surgery anymore. And if you look at what we've been able to do, being able to take care of spinal problems in much less invasive ways has been one critical part. So, we used to have to do a lot of damage to the body in terms of getting in there to fix things. And there were tremendous ramifications to how invasive the surgery was and the damage we did on the way in and out. And being able to work through small incisions without cutting muscle. And it's not just about getting people up and out of the hospital faster, but being able to damage their body less as part of going after whatever their problem is. And another tremendous advancement, and really many of the people who are in this room and represented by people in this room, we're talking about, we see how critical the business side, engineering, the medical people working together to design better and improved implants, and working toward ways to take care of people's problems that preserves motion in their body rather than eliminating motion, and taking care of spinal problems by replacing discs with an arthroplasty or a disc replacement rather than a fusion, which eliminates motion. And bringing all these things together, to me, is really the future. And so I'm really passionate about the technical side of what we can do. And finally, I think if we look in the future, this is going to be really about using computers, using really exciting technologies like robotics, like navigation, augmented reality, to help surgeons see inside the body and take care of problems inside the body without having to cut it open and disrupt things to get there. And if we look at how we're able to take care of patients' problems compared to how we were able to do that even 10 or 20 years ago, it's been a tremendous advancement. And so, to me, I think, we look at people who've had spine surgery over the years, and you compare notes, and it's really kind of terrifying. And if you are going through these kind of problems, getting educated and understanding what is the current option, what is the current technique, because as we're hearing from so many of these spinal champions, there really are options, and there is life after spine surgery.
I think you guys are also doing this one study looking at enhanced recovery after surgery. So not just the technical aspect, but also getting the patient ready for surgery. So Virginia Spine Institute is doing this one study where you're trying to do prepare the patient prior to surgery better than we used to before in terms of optimizing their nutritional status and making sure they're not given as much opiates during the anesthetic. That leads to a better recovery afterwards, and you're getting your patients out of the hospital earlier. You're ambulating them a lot faster. You're giving them less opiates after surgery. So that's one thing, aside from the technical aspect of surgery, that's important too, that I think Dr. Giussini is just looking at that study as well. But there's also patient education is also very, very important in terms of knowing that, you're not going to be bedridden for like 4 or 5, 6 weeks after surgery, that, you can get out of the hospital in 4 days, and, that, yeah, there is hope, and that this is not, you're not going to be handicapped at all after surgery. Because the nice thing is, like, several people around here are walking around with lumbar fusions, and you couldn't tell them apart from the people who have not had back surgery. That's the thing with lumbar fusions. Whereas if you see some of the hips, right, it's a totally different surgery.
Yeah, no, it is phenomenal. I mean, actually, I sit up here with a fusion in my neck and 2 artificial discs. So,
and you can't tell.
It's something which with the technology today, we're putting people back to their lives. So, yes.
This enhanced recovery after surgery is really cool. And one thing that's exciting about it is I feel like this is something we're involved with, and a lot of doctors that we're going to end up helping thousands of patients that we'll never meet. And what we're seeing, and we just actually got this accepted, and we're presenting this, but basically using techniques to enhance how we're doing surgery and improve everything from pre-op surgery to the way we're controlling pain around surgery and getting people out. We're showing that we're getting people out of the hospital faster with less pain and needing less narcotic pain medication to get through their surgeries. And so super exciting. And a great thing about that is, we can get every surgeon in the country, right? Everybody agrees that this is something that's phenomenal. And so the future of what we're going to be able to achieve when we get all these people on board is super exciting.
It's interesting because one of the steps is just making sure that they chew gum after surgery. So just the simple act of having your patient chew gum as soon as they can, and it helps your bowel start functioning again. I mean, something as simple as that is pretty interesting, that gum actually making your patients chew gum.
And it's really the concept of looking at the entire patient package, and something that's been bad in the surgical world and really bad in the spine surgical world was really not looking at this. And we have to applaud Dr. Good, because he's leading the charge with HCA across their 187 hospitals to advance this nationally and internationally, actually, throughout the world. So truly, that's a simple thing if you take a look at it. Better nutrition, better pain control, trying to stay out of the opioid issue that we're all aware of is a crisis today. And this will continue to evolve. and potentially as marijuana may become part of this process and using things like that to stay away from the opioids. But to our question in the audience.
In the past, when someone thought about back surgery, it meant one surgery and the worry that perhaps you'd have to have a second surgery. My 82-year-old father-in-law had his first surgery at 65 and his second one at 75. Are you still seeing that as something in the back surgery industry and world?
So obviously having multiple surgeries is a concern, but with the changes that are coming, and I think that's what you're alluding to, is what are we doing to decrease one surgery begets another. And so, Dr. Good?
Well, I do think the spine is complicated because we are dealing with lots of different structures, right? I mean, think of a roller coaster going around on the tracks, and we have all these different joints and all these things attached. And just because one gets fixed doesn't necessarily mean that another one can't go bad. It's been a challenge. But if you look at old school, the traditional surgeries had a lot of issues. We were disrupting the important supporting structures of the back. We were cutting the back open, and we were actually fusing people in probably not the right alignment of their spine. Now, these were advancements over time, but if you look at what we're doing now, by going in minimally invasive and we're not cutting the muscles and disrupting everything, it's much better for the spine down the road. And really, and again, to applaud a lot of the people who are here with industry, representing industry and the engineers, we are now, by designing better implants that have better shapes, we're realigning the spine better if we do have to do a fusion. And what we're showing in the studies is that leads to a much lower likelihood of having another problem go on down the road. And so fixing one level can't prevent all the other levels from going bad. And you know, as Dr. Schuler always says, life is a degenerative process, and you can't choose your parents. So we are fighting natural history and aging, but tremendous advancements in what we're doing in terms of fixing a current problem and looking at a major decrease in the risk for troubles at the next disc up compared to what we were looking at 10 years ago. And so really super exciting things that are going on in that area.
I like to talk frequently about how to live a healthier spine life, a healthier life altogether. And the number one cornerstone of that is nicotine abstinence. Nicotine is probably the number one thing you can do to your body that can upset the apple cart so badly, whether it's accelerating degeneration, impairing the healing, not to mention cancer, heart disease, lung disease. So nicotine abstinence is absolutely the cornerstone of prevention. Then when you get beyond that, it comes down to saying, are we keeping our body at an appropriate weight? It comes down to dietary control. Are you using the right nutrition? Are you eating a proper diet so that you're eating well-balanced natural foods in appropriate portions so that you keep your weight at a reasonable level? Because you can't land a 747 on Volkswagen tires. So you got to make sure that you got people on the right size for what they're supporting their spine on. And then it comes down to proper exercise. We all need good flexibility, core strength. So maintaining a proper fitness program, flexibility, core strength are all essential. When you get beyond that, you start talking about, am I happy? Is my stress under control? Am I sleeping? And those are the simple things. But in a nutshell, those are simple keys to preventing spine problems. The last caveat I would put in is just ergonomics. You got to lift properly, move properly. And I like to talk about squatting. While we squat every time we sit in a chair, heavy squatting in the gym is probably the best thing for the spine business. And so we got to be sensible about what we're doing and make sure that we're using common sense. But that would be my summary of it. I don't know if you'd like to comment.
Yeah, in England, we used to say, we'd have spine patients come in and it's always, lose 2 stones, stop smoking and exercise, or we'll send you off to Liverpool, is what we used to do. That was always the line. It's like, lose 2 stones, stop smoking and exercise, or we send you off to Liverpool. I was working in Nottingham then. But to add to the smoking is, the thing is, even if we did this one study where we looked at smokers in particular, and even if you get them to fuse, their quality of life still does not improve. So it's not really the fusion. There's still something about smoking that their quality of life is still worse, even if you get them to fuse, than normal people. So yeah, stop smoking, exercising.
What Dr. Schuler says, I think, applies to everybody, right? Whether you have a spine problem or not.
Yep.
As we go through our lives, we all start to accumulate things that are probably going to be our Achilles heel later on, right? And the decisions we're making in our teens and our 20s, lots of us can actually look down the road and figure out what problem we're going to be dealing with down the road and whether that's an orthopedic problem or not. And so there really becomes a point, and if you're lucky, it's in your 50s or 60s, but for many people it's quite a bit earlier, where you start to have to make a decision between longevity or staying that elite power athlete that you were once or that you think you were. And as you start to look at the benefits of exercise, they're phenomenal, but doing the wrong thing can really push you in the wrong direction pretty quickly. And so you have to step back and start to say, based on what I'm dealing with, what are my problems, how do I really optimize that? Because what we really all want to be able to do, I believe, is to be able to walk around and enjoy our lives as we get older. And you look at Tiger, right? Perfect example. He's talking about his kids, right? And that's what our patients are trying to get back to is doing normal things with their families. This is personal to me. Both my parents had back surgery, and for 2 years, my mom hasn't been able to have her grandkids over to her house, and so she had her whole spine fused, and it's been a long road. But the kids are actually at her house for the first time tonight, spending the night for 2 years. So, it's very powerful.